Japan considers downgrading COVID-19 to same level as seasonal flu. A crowd outside the Tokyo station on January 20, 2023. Tokyo CNN, Japan will consider downgrading COVID-19 to the same category as seasonal flu influenza this spring, Prime Minister Fumio Kishida announced Friday. Kishida said he had instructed the health ministry officials to discuss the move, and his administration would also review rules on face masks and other pandemic measures. In order to further advance the effort of living with corona and restore Japan to a state of the normalcy, we will transition the various policies and measures to date in pages, Kishida said. While daily COVID-19 cases in Japan have declined in recent weeks, the country still faces around 100,000 new infections a day. COVID-19 is categorized as the class 2 disease, the same status as tuberculosis and avian influenza, according to Japan's health ministry. Officials will now discuss reclassifying it to classify the lowest rank, which includes the seasonal flu. Japan fully reopened its borders to overseas visitors last October after more than 2 years of pandemic restrictions, ending one of the world's strictest border controls. Japan's Prime Minister Fumio Kishida has asked the health ministry to discuss downgrading the status of COVID-19. Influenza, or the common flu, and COVID-19 were both contagious respiratory illnesses with similar symptoms, but they are caused by different viruses and require testing to confirm a diagnosis. The United States Centers for Disease Control and Prevention, called the CDC, says on its website. According to the CDC, the risk of death or hospitalization from COVID-19 is greatly reduced from most people due to high levels of vaccination and population immunity from previous infections. However, the World Health Organization still lists the coronavirus outbreak as the pandemic and reiterated its latest update, a recommendation for people to wear masks following risk exposure or close contact with COVID-19, and for anyone in a crowded, enclosed, or fully ventilated space to do the same. WHO Director General Pedros Adhanom Ghebreyesus called on government last week to continue sharing the sequencing data of the coronavirus, as it remained vital to detect and track the emergence and spread of new variants. It's understandable that countries cannot maintain the same levels of testing and sequencing they had during the Omicron peak. At the same time, the world cannot close its eyes and hope that this virus will go away. It won't, he said. South Korea eases indoor mask mandate. The news came as South Korea announced that it will lift its mask mandate for most indoor areas, with exceptions for public transport and health facilities. The changes will take effect on January 30. South Korean Prime Minister Han Duck-soo said Friday. The measure will be lifted after the Lunar New Year holiday, when a large number of people are expected to travel. The Korea Disease Control and Prevention Agency, called the KDCA, said. The new COVID-19 cases, severe cases, and the related deaths are all declining. The country's medical response capacity remains stable, KDCA added. The agency has strongly recommended people wear masks if they have COVID-19 related symptoms belong to a high-risk group have been in contact recently with a positive case or on a crowded space. Masks will still be required on public transport and in health facilities after South Korea eases its indoor mask mandate on January 30, 2023. The Prime Minister said the easing of the mandate could result in the temporary surge of new cases and urged health authorities to stay vigilant. South Korea has scrapped most of its pandemic restrictions and eased its outdoor mask mandate in May 2022. It still requires people who test positive to undergo 7 days of the home isolation. The country has also restricted travel from mainland China and implemented testing requirements for people arriving from China, Hong Kong, and Macau following Beijing's easing of COVID restrictions.